We are learning the COVID-19 vaccine can have an impact on the timing of mammograms. NewsNation's Kim Posey has that information on the new guidance from health professionals tonight.
The Society for Breast Imaging has some new guidelines concerning the COVID-19 vaccine and mammograms. So you may get some new questions when you call to schedule. Michelle Garcia is an ICU nurse in Inglewood.
I received the Pfizer vaccine.
She and her coworkers have received both doses of vaccine, and some noticed an interesting side effect.
Probably 5 or 6 friends who ended up with the lymph node enlargement under their arms from the vaccine.
While that itself is not problematic, those findings could affect a mammogram.
We are seeing a rise in axillary swelling, or basically your armpit is swollen.
Dr. Louis Enriquez is the breast imaging radiologist with the Medical Center of Aurora.
When we do see it on imaging, we are obligated to kind of work that up and understand, is this just a result of the vaccine or not?
That workup could include diagnostic imaging or more.
What we're recommending is that referring physicians and patients do what they can to try to get their breast imaging, if they have a screening mammogram that they might be due for, or a screening breast MRI, that they try to do that before their first dose of the COVID vaccine.
If not, his clinic recommends waiting 6 to 8 weeks after the second dose. Of course, some women cannot reschedule, and it is important to stay up to date with regular screenings. So talk to your provider.
I have a history of a fibrocystic breast disease.
Michelle Garcia is glad she's in the clear with her mammogram.
I usually get one every year. Luckily, I had one before I had the vaccine.
Kim Posey, News Nation.